So we're really fortunate to have 2 BCMA CAR T-cell products now approved for relapsed refractory myeloma, and we're really seeing unprecedented response rates and durability of response in a really highly refractory population. That being said, there still are certainly areas for improvement. So I think some of the unmet needs include certainly a lot of logistical issues around manufacturing that could be better, improved number of slots, more rapid manufacturing so that we don't have patients progressing during the manufacturing, improved lymphodepleting options to limit the risk of prolonged cytopenias and MDS. And then in terms of once patients actually get their CAR product, we still unfortunately have a subset of patients who have either not a complete response or a short duration of response. And so there's a lot of efforts underway trying to figure out biomarkers of which patients are likely to have a suboptimal response and see if we can predict those patients ahead of time and perhaps intervene post-CAR T cells with additional therapy. And then finally, I think we still need to do a better job of mitigating the toxicities of these CAR T cell products, so decreasing the risk of CRS or neurotoxicity, or at least high-grade CRS and neurotox, and then particularly trying to decrease the risk of long-term infections. And that's something that's certainly emerging, and I think we're doing a better job, but still need to do a little bit more.